Welcome, everybody, to part four of what we are calling the What is a Medically Tailored Meal series, in which we're giving our audience a deep dive into the food as medicine movement to give them a better understanding of medically tailored meals and their outcomes in our communities. Today, we are looking at what's next and current policy updates with our friend Alissa Wassung, the executive director at the Food is Medicine Coalition. Alissa, thank you for joining me this morning. And if it would be okay with you, I'd love to start with you giving us a little bit about your background. What brought you to FIMC? How long you've been there? Did I pronounce your last name right? Maybe we could
You
start
did.
there.
Thanks so much, Ethan. I'm so happy to be in conversation with you today, talking about my favorite topic, medically tailored meals, and just talking about it with you, such an amazing partner, Open Arms of Minnesota, and all the great work you do in community. It's really kind of exemplifies why FIMC exists. And for those of you who are new to the Food is Medicine Coalition, FIMC is our acronym, and what we affectionately call our coalition is a shorthand. So I am Alissa Wassung, great pronunciation. It's a funny last name. I use she, her pronouns, and I am honored to be the executive director of the Food is Medicine Coalition. I've been in the food as medicine field for about 15 years. Got my start at God's Love We Deliver, the non-sectarian nonprofit provider of MTM in New York City. And I got that start after thinking that I was going to become a lawyer and pursue, justice in that direction. Found bioethics in my training in political science, and really pursued a career in social justice. The mission of God's Love was incredibly compelling to me, combining the power of nutrition and healthcare to achieve better health outcomes for people who were sick and hungry. And that's kind of, the rest is history a little bit. At God's Love, I joined right after the Affordable Care Act was passed. And so was at that beginning moment of the expansion of Medicaid and the integration of alternate modalities into the provision of healthcare for individuals across the country, as well as really deeply learning the Ryan White HIV/AIDS program, and becoming an advocate for people living with HIV. So those two kind of combined to allow the growth of a really sophisticated policy and planning department at God's Love, thanks to our now chair of FIMC, Karen Pearl, then president and CEO at God's Love. It was sort of also on the cusp of Medicaid expansion and reconsideration in New York State. New York State has one of the biggest Medicaid programs in the country, and so was looking for ways to improve care and cut costs. So there are a lot of really fun acronyms that came into play there that I will not bore you with now. But it really helped me to understand the many different facets of what is required to adequately and with quality and care provide the service for people.
Gotcha. What a background, and very um, to our advancement as members of FIMIC, right? We are lucky that you found your way into this role, and you've done such great things over the years. And my 2+ years working at Open Arms in Minnesota has been it's been really fun to see you expand FIMIC's reach and all the great things that you've done. So props to you, Alissa, and thank you for finding your way to FIMIC and for being such a great partner of ours. So why don't we dive in? We're talking about medically tailored meals in this series. So, why don't we start at the beginning here? And could you give us a broad overview of the Food is Medicine's Coalition, Food is Medicine Coalition, what their role is, mission, and providing medically tailored meals, or what we call
Absolutely.
MTMs, right?
Yeah, exactly. And I'll try to unacronym what we talk about today.
Yeah,
Super easy in healthcare. A colleague of mine is in the education field, had this whole conversation and it was completely acronyms. And I was like, I have no idea what you just said, but I could do it in healthcare if you'd like.
sure.
So we'll try to unacronym our conversation today. So during my time at God's Love, I was privileged to really grow the Food as Medicine Coalition's reach alongside colleagues in the field, so much so that we were able to receive some seed funding that broke off the national office. And for the last 2 years, I've been able to just focus solely on FIMC's role in the field and supporting local agencies. The shorthand for the Food as Medicine Coalition is that we're the national coalition of nonprofits that deliver both medically tailored meals and groceries alongside really important nutrition pieces like medical nutrition therapy, nutrition counseling, and education. And our focus is on people and communities across the country living with severe, complex, or chronic illnesses. Right now in the food as medicine movement, there's a lot of conversation and focus on diet-related illnesses. And of course, we are feeding people with diet-related illnesses, but we have a bigger lens around all illnesses that affect people's ability to eat and nourish themselves. Our goal as a coalition is to advance equitable access to those services. And we do that through policy change, research and evaluation, and best practices. And best practices is, I think, where we're going to focus a lot today, because one of the biggest pieces of news from our coalitions here is the release of the first ever standard for delivering life-saving medically tailored meals. An important fact about FIMC agencies is like Open Arms of Minnesota, Community Serving in Boston, Project Angel Heart in Colorado, insert awesome community based organization name there. These agencies actually created the medically tailored meal model almost 40 years ago at this point in response to community need during the HIV epidemic. When volunteers saw a need, people were living with HIV at home, isolated, often stigmatized and separated from community. Volunteers entered that situation bringing dignity in the form of food, but that food is unusable for someone who can't cook for themselves. And so it quickly evolved into the meal model you see today. Also adding in the services of a registered dietitian so that the meals and the intervention was appropriate for that disease state. And then very soon after, of course, expanding missions because people in communities across the country said, hey, my friend has cancer, can you help them? My friend has Parkinson's, can you help them? And most of our agencies said, yes, we can. And so over time, those tailored meal models evolved to serve people living largely with multiple illnesses at once and very complex medical lives. And what we're seeing today, and I think why, our mission to advance policy, promote research and maintain best practices is over the last 10 years, there's been a lot of research that has shown, unsurprisingly, adding these interventions to someone's care plan helps them stay healthy, helps lower the cost of care, and, from a mission perspective, keeps people happy, satisfaction with life. And so that's led to a lot of healthcare integration, states really leveraging kind of what I talked about in the New York instance, some of these flexibilities to provide this service to people in insurance programs. But the real important piece of that is, with all the focus on food as medicine today, all the advancements that I just said, there are huge gaps across the country in the provision of this service. It's still largely unavailable to most people, or available only through the provision of free services through agencies like those in our coalition. And so our vision is that there will be a future where everyone who needs this service has access to it, that it is of the highest quality, and that access is not hampered by ability to pay or where you live. And so together we unite around that vision. And today I think we're going to get to talk a little bit about what that looks like in real life.
For sure we will. And it's so interesting. You touch on the history of medically tailored meals and how many of us started within the AIDS, HIV pandemic, right, in the 80s, but that this is an evolving and a very complex subject that it's just not, we couldn't just define the thing, right? Like even a few years ago, like we didn't have a great, definition of a medically tailored meal. And like now I think a very important thing FIMC has done, I was telling my colleagues the other day, is like you've defined a medically tailored meal and like we as agencies are on board on this. And I think that standard that you touched on is really important for people to to understand not only where we are now, but where we came from, right? A lot of research went into this, and that's really cool to see that we've started to develop these standards within this food as medicine world here. So tell me, how does FIMC, how does the Food as Medicine Coalition ensure that its accredited programs maintain high standards and then deliver effective evidence-based interventions?
Well, that's a big subject. So I think I'll start probably to answer that question with what you alluded to around the context, you
Sure.
know. Um, I can't tell you how many times I'm in a room and I talk about our history, and folks are surprised that we've been around for decades doing this
Mm.
great work in the community. So it's been amazing to see the growth of interest in food as medicine. I think we can attribute that to a variety of factors. The research I mentioned, right? The high cost of healthcare,
Mhm.
and the growing number of people who need intensive interventions. But really, more recently, the COVID-19 pandemic. All of our agencies across the country were essential service providers. They sprang into action as more and more vulnerable populations were sent home. We saw, just expanding enrollment rates. And I think the result of COVID was to display very viscerally for people across the country the reality of food insecurity and food access issues in our communities, which many service providers already understood, but it was just undeniable. And so that led to the amazing White House conference on hunger, nutrition, and health that was held in 2022, a renewed interest in providing quality nutrition, not just food, but really good food. And with the popularity and I think the success of that focus, it's led to organizations adopting and using the terms of food as medicine, but not actually delivering the service. So as this service is becoming incorporated into healthcare, we thought it was just really necessary to ensure that individuals are getting high quality good service. This was kind of a sort of mission critical definition for us. So we embarked on a process to synthesize our 40 years of experience into a standard for the field, really the fulsome definition of what the medically tailored meal intervention is. First, that it is not just a meal, it's not just food. It is a whole process of ensuring that someone has nutrition care and care. And our agencies are known for those impressive research outcomes or just programmatic outcomes that our programs produce. And we know that that's not possible without nutritious food, without community connection, and without a client-centered approach. And so the standard we've created codifies all of that and offers it to the field really as a guidebook for meeting community needs. Importantly, we released our standard publicly. We
Mhm.
aimed, and in the service of mission, right? We aimed for it to enter these really important conversations about how we best serve populations at this point in our healthcare journey. And meeting the requirements of the accreditation criteria and requirements, affectionately called the ACR. So if I say ACR, that's what I mean. It really ensures that clients are receiving quality care, and clients are really at the center of the standard. Part of, the second part of your question about how we ensure that quality is provided, our standard is both rigorous where it counts and then flexible where it's important. Our intervention grew up in community, and so it needed to reflect that diversity. So there are some really important and very rigorous non-negotiables in the standard, like our nutrition standards, which we'll talk about a little later. But we intend for the standard to be ensuring that regardless of location or size or number of clients, that high quality intervention is provided, but that it's provided in a culturally relevant, community responsive way.
Mm.
So there is, there are areas of the standard that are meant to be flexible.
Mm.
And so I think then the probably remaining questions for those of you listening is, what is it, right? It's a set of requirements and best practices for delivering the intervention. And what it does is set up kind of a guidebook for community-based organizations to follow in setting up these programs and then complying with them in an ongoing way. So it requires annual self-evaluations where an agency conducts an internal audit of their operations against the 8 pillars of the standard. And then we also physically visit these agencies to confirm that they're doing what they say that they are doing. We do that every 3 years. And that includes remote document review and, this on-site confirmation. And then once an agency has been audited, there's an allowance period to close any gaps with the standard before an accreditation decision is made. So all of you nonprofits out there that are interested in the program, please come talk to us about it. We have a wonderful manager of accreditation and membership who can help explain what the process is like, and explain the benefits of going through the process as well. I'm happy to dig into the pillars if you want me to, but that's kind of how we seek to ensure that an ethic of care is delivered to our clients.
That's perfect, Alyssa. And I will say, Open Arms is an accredited agency at this
Congratulations!
point. Yeah, thank you. It was a great process, and I will say that everyone at Open Arms took a lot of pride in being a part of it, and have taken a lot of pride in being one of the first agencies and to meet that standard that we've all agreed on. Has been a certain pride point for all of us at Open Arms. So thank you. And also I want to touch on a few things you said in your answer there, that I think it is important for people to remember that a meal is just not a meal, right? It's a process, right? That includes a lot of different elements outside of the physical food, right? And another important thing, I think you hit on the head, you will hear our CEO say this daily, if not, or weekly, if not daily, that clients are at the center of everything we do, right? And that client-focused approach is so important for you and the accreditation and everything we do. I don't think we should lose that point at any point here.
Yeah, and just to, build on that, Ethan, right now we're hearing, every single conversation I'm involved in about food as medicine inevitably references scale because we started in community as responding to community. How do we bring this to everybody? We have a couple programs that are aiming to do that, but I think what the standard also encapsulates is the things that don't scale, right? There are things that scale, but some things are meant to be human sized. They're meant to be at the scale of an individual. And I think that we've aimed to strike that balance in the standard and make sure that that person-centered approach is still there.
Gotcha. Well, staying on that theme of, looking to the future here and scaling, what current initiatives or research are you involved in at FIMC that are potentially shaping the future of medically tailored meals?
Oh my goodness. FIMC has a really strong strategic plan that focuses on advancing health equity, building capacity, strengthening policy and ensuring sustainability for our organizations going forward. Again, most of our organizations are primarily still supported by philanthropy, which is very different than most of the anti-hunger or nutrition world. And so that focus on supportive policies that encourage states to leverage the existing flexibilities or the federal government to take action on inconsistencies is a really key focus of FIMC. I would really term that a small p policy. And a great example of that is in July, we were so excited to release with our co-writers, the Center for Health Law and Policy Innovation at Harvard Law School, affectionately called CHILPI. Just a brilliant set of lawyers and policy folks, the State Medicaid Policy Toolkit. It is available, again, for free on our website. It's been printed and distributed in a variety of different gatherings. But what it does is it takes all that CMS, Centers for Medicare and Medicaid Services, has said about how to provide these services in states and brings it all together in a comprehensible framework, and talks about the cross-cutting requirements from a regulatory perspective that states would need to comply with to deliver these services. So kind of a let's not reinvent the wheel If you're
Mhm.
interested, choose this adventure. This is what you need to do. Choose this adventure. This is what you need to do. And so we hope that that's really useful. Obviously, it's going to need to be updated as new guidance comes out. But it is hopefully not just a tool for state Medicaid policymakers, but also advocates in learning all of the ins and outs of provision of these services and expanding that equity of access. At the end, there's a great kind of cross-cutting considerations section about, so this is the regulation, but what does it look like to implement it? These are some of the flags you should be paying attention to as you bring it into community. And so we've had a lot of really great conversations about it. We've already heard folks are using it. We've heard some state Medicaid directors are excited about it.
Mm.
So really exciting for us to provide some of that advancing or strengthening policy resources. Um, then I'd say, in the research area, FIMC agencies are still leading in that area. We just got some of our raw data from the national survey back. I don't want to scoop us because we're going to release it more publicly on our quarterly meeting on October 10th. So attend if you want to hear more. But there are a variety of ongoing studies happening at agencies. I think agencies across the country have over 30 academic partnerships that are proceeding, and they're in process and new research is coming out every day, but that's just really strong. And then I think we're also seeing the rise of field-wide initiatives, like the American Heart Association and Rockefeller Foundation's Healthcare by Food initiative. And that's really a very long-term, large-scale initiative to provide the evidence that's needed to show clinical and cost savings or cost effectiveness so that we can begin to build these interventions more fully into healthcare. Three of our amazing organizations at FIMC were awarded in the first round, Project Open Hand in San Francisco, Community Serving in Boston, and God's Love We Deliver in New York, along with their research teams. And then I have the honor of serving on the Strategic Integration Group, which is really aimed at taking whatever's found in research and practically translating it to the real world. So I'm excited to see what comes out of that, right? We've got everybody focused on something. And the same is true for the work that HHS, Health and Human Services, is doing cross-governmentally to coordinate on a food as medicine plan. And there's a big release coming out actually Monday of the work that they've done that I've also had the privilege of being involved in around data and measures. We all know if we don't measure it, it doesn't exist. And
Mm.
so I just really appreciate what the Office of Disease Prevention and Health Promotion has done to convene a bunch of diverse thinkers about what is meaningful to gather in food as medicine measurement. And then last thing, because I know there's a lot of initiatives happening.
Yeah.
These are largely external initiatives, so I'm happy to talk about some of the internal work we've done, like on health equity.
Mm.
But this one's really big. This is called Coding for Food. And what has come out of this long trajectory of food as medicine integration is we can't accurately talk about it in someone's medical record. Like, I can't tell you what service someone was provided because there's only one code for home delivered meals. It
Mm.
doesn't actually reflect all the work of a medically tailored meal. So the Coding for Food initiative aims to create some of those codes that will more accurately tell someone's healthcare story in a medical record and allow us also to track impact.
Wow, that's so interesting. I mean, coding for people that, have, gone through the healthcare system, what a big topic of conversation. Wow,
Mhm.
that's so fascinating to me. And I should probably, pause and give a plug here. FIMIC's website is awesome. All
Oh,
this
thank you.
information is there. They are pros at giving you all the data you would ever need and then some. But yes, that is a great resource for everybody that's listening to this conversation and something peaks in their ears, like the choose your own adventure thing. Please go to FIMIC's website and check out all their stuff. So last, to close the loop on the emerging things and practices happening within food as medicine. This is kind of your sweet spot here, Alissa. How about any legislative and policy efforts or maybe changes that you're maybe excited about or looking to in the future here?
Absolutely. Thanks for setting that one up, Ethan. He knows me well after 2 years of hearing me talk about policy.
The pro's
Um,
pro at policy.
I love policy. Policy is just such an area of tremendous change and affects how things work on the ground. So we know that there is a lot of research around medically tailored meals, but we can always do more. And I think one of the research priorities for our coalition is larger, more representative studies. And sometimes that conversation affects our ability to move forward in reimbursement and service provision because we're saying, well, we need bigger studies. Well, we need funding to do bigger studies and just sort of keep going around. And so in 2020, a group of wonderful bipartisan supporters in Congress, Representative Jim McGovern from Massachusetts, Representative Malliotakis, Evans, Fitzpatrick, and Pingree, put forth a medically tailored meal bill. And this is a demonstration pilot that is essentially a large research study. It's aimed at testing and laying to rest any questions we have about the effectiveness of this intervention. And it's focusing on geographically diverse populations. So answering that question too, does it work in all instances? It would be run through Medicare Part A, so it's a hospital side of public insurance provision for older Americans and those living with disabilities. And it is designed in that arena because of the clinical care outcomes that need to be gathered, and also because there's no provision, period, of any food-based service mirroring medically tailored meals in Part A. There's a little bit of flexibility in the managed care side of Medicare for older Americans, but nothing in original Medicare. So it's both an equity and a research project. This bill would test the intervention originally in 20 hospitals, but there's been some progress. Now it's 40. And then after the completion of the study or the intervention, issue a report. So there's been some really exciting movement over the 4 years since that bill was introduced. Last year, we saw the kind of peer bill in the Senate side come to be, again, bipartisan, with Senators Stabenow, Senator Marshall, Booker, and Cassidy, all supporting the Senate side bill. And then this year, just recently over the summer, the Committee of Jurisdiction, the Ways and Means Committee, considered it on the House side as part of a larger healthcare package, HR 8816, and passed it out of committee unanimously with some really compelling testimony from Representative Malliotakis, for one, and others about why MTM is so important. Highly suggest that if you want some encouragement today, go watch that hearing. It's short and sweet. But now it's available to be incorporated into any end of year package that Congress might negotiate. So just really incredible progress. This could provide needed nutrition to so many clients across the country, but also give us, more of that evidence base that we need to move coverage forward.
Sure. And how cool is it that we are talking about medically tailored meals on the Senate and the House floors, right? I mean, this is just a
It's
fascinating world we live in. This is so emerging. It's just so cool to see, all the work that you've done behind the scenes start to come out and play a role in the public eye at this point. And it's great for us FIMIC organizations as well. So kind of switching gears here, moving more into like how FIMIC, works with agencies like Open Arms in Minnesota, like all our other members of FIMIC. But I'm curious, how does the Food as Medicine Coalition help expand the reach of medically tailored meals programs to underserved populations or areas with limited access? I think you kind of touched on this a little bit, but curious to take a little deeper dive into this one.
Absolutely. Equity of access is like part of that vision, right, that I talked
Yeah,
about at the beginning. And so, what we do is work in the current reality toward a future reality. So the current reality is that we must create new medically tailored meal programs that can both partner with healthcare, but
Mm,
also feed people for free. So that
mm,
is why we focus on nonprofits in the current context of the food as medicine landscape. One of the main ways that we encourage that creation of new programs is through our Food as Medicine Coalition Accelerator. It is a capacity building curriculum that is about a year long, where 4 to 5 new to medically tailored meals nonprofits enter the program and learn how to do what we do.
mm.
It is run by some very strong partner organizations, Community Servings in Boston, and MTM provider God's Love We Deliver in New York, alongside the Center for Health Law and Policy Innovation that provides that policy context, and the Nonprofit Finance Fund, so that the program's sustainable, right? And they're learning good fiscal practices. To date, we've graduated 17 new programs in new states and localities, as well as in areas that we're adding programmatic, capacity to. And
Sure.
this year we have 5 new agencies that have joined.
Wow.
Um, so that's a real arena of constant reflection too, and self-assessment as we try to maximize our knowledge and our ability to raise all boats. And then, for existing agencies, we have a really robust technical assistance and capacity building program through our membership. So we run a technical assistance series on anything from kitchen technologies that people are using to, how an 1115 waiver works in your
Mm,
state, to, how to best partner with plans for maximum effect. So a real diversity of focal points. And then I think, in terms of expanding reach, all that I just said about national policy kind of overarches all of that.
mm,
Um, you know, the reason why there is lack of access is lack of funding.
mm.
And as we create new mechanisms to leverage some of the existing opportunities, that really changes the calculus for access in places across the country.
Lack of access equals lack of funding. I like that.
And vice versa.
It's a great framing. And kind of to piggyback off of that, as you look to the future, you're so immersed in this. Somebody that's potentially new to food as medicine or medically tailored meals, what do you think key areas of focus are for that person when we're talking about advancing the integration of food and health?
Well, 8 hours later in this conversation, um, the short answer to that, I think, is the boring stuff. Um, People love to talk about nutrition and delicious meals and client connection, and those are all incredibly important. The question is, how do those things come into the healthcare system while preserving their core attributes?
Sure.
And some of that is through some of the boring stuff, like what does service approval look like? What does
Mm,
eligibility and assessment and documentation look like? Some of the standards work that we're doing around nutrition guidelines. But really the mechanics of the intervention, working within a context of clinical care, working within data and privacy requirements. Some of this is in the state Medicaid toolkit, so just so you know.
mhm,
But that's the real stuff of
mm,
like making sure people aren't falling through any cracks that might be created in our system. Um, and I think there's 2 other areas that are both research focuses for us, but also policy and capacity building focuses. The first is person-centered care. I'm really encouraged that our conversation about research is moving beyond what redounds as a benefit to the healthcare system, which is great, right? We need better clinical
mhm,
outcomes. That's also an individual plus. We need cost savings, hopefully also an individual plus. But what is the patient-centered outcomes that patients are feeling good about, right? That motivate them to continue to engage, to have a better quality of life.
mm,
And then health equity. How is all of the structure that we're creating actually longitudinally changing the difference in outcomes that different populations produce as a result of the systems that they're involved in. And FIMC has concentrated on that really deeply internally, but then also hoping to bring some of that out into the field.
This is why Alyssa's so good at policy, because she doesn't want to just talk about the sexy stuff, right? She wants to get into the weeds and get into
Of course,
policy and get
it
into the
matters.
real, right, Alyssa? But this is a great, I mean, this is a shout out to FIMIC, and its role is that you're doing this work for the benefit of all of us agencies, right? And all the internal things that you do, they spread out to the open arms of Minnesota's of the world, right? And then we use this and piggyback off of all of it. So it's great stuff. But yeah, it's not the bright and shiny at all times, is
Sometimes
it?
it's not, but it really matters. It really
Yeah.
matters. So,
Yeah. A few more questions for you here, if that's okay.
of course.
Yeah. So what role do you see partnerships between organizations like Open Arms in Minnesota and the Food is Medicine Coalition playing in advancing this movement, this food is medicine movement?
I mean, FIMIC is unable to do any of what we've just been talking about without our partners on the ground. I
Mm,
mean, they are what make FIMIC possible. Open Arms is what makes FIMIC possible. Those connections are critical. The standard is a reflection of decades of wisdom and service delivery that is not FIMIC's to own. And those implementation learnings of like implementing the standard or implementing new programs in real time, the bidirectional learning is absolutely vital to making sure that what we're kind of creating large scale, whatever that might be, is reflective of community need. Because if we're not meeting the needs of community, we might as well just stop the whole project at this point, right?
mhm.
And so that bidirectional learning is central to why it makes sense for FIMIC to be a member organization. And I would say very clearly that cultural responsiveness and community integration is another clear area where FIMIC just can't do our work without our
Mm,
member agencies. I don't know what, Minnesota needs. You do, right? Because you're
yep,
actually asking your communities
yep.
what they need, or creating programs in partnership with clients. Um, and that's really where the magic happens in
Mm,
my mind. In fact, I think one of the things we're seeing right now, since this grew up in community and is kind of making its way into the healthcare system, is a desire to really define the value that community-based organizations bring to this work. And some of it I've said, some of it I think we need to continue to articulate. But that's definitely what I would say.
Gotcha. It's that partnership. It's what FIMIC offers Open Arms in Minnesota, what offers God's Love We Deliver to take back into their communities, right? It's a marriage of us two that really make an impact. I think that's important to highlight. It's a great point, Alyssa. So to wrap things up here, if you were to tell somebody to keep your eye out for, let's say, one to two things coming out of food as medicine, coming out of FIMIC, coming, in this world of medically tailored meals for the remainder of 2024, what are those one to two things you're looking to, or you're asking people to keep an eye out for?
Well, I think, going back up to the 30,000-foot view for a second, I think we can all acknowledge that the progress of the food as medicine movement has been a bit like drinking from a fire hose, right? So much energy, so much evolution, so much interest, and I think we can all be really grateful for that. So I'm glad that the timeline you asked me about is just the next few months. And I would say if I had to pick two, the first one would be what the HHS folks are releasing on Monday, September 30th.
Mhm.
Um, and it will be a website that kind of catalogs the work that's being done on that cross governmental, field-wide measurement and evaluation strategy, resources, etc. For those of you who are our members, we're going to distribute the opportunity to tune into a webinar on Monday, but I think it's for the whole field. That really has that kind of coordinating work, that kind of structural work, has long-reaching effects for organizing how we move forward. And I think that as a person participating in that project, it's really been done thoughtfully. And I very much respect the work that I got to do as part of that group. And the second is the coding for food work, because we are aiming for January submissions for these billing codes. So it's a rapid iteration workflow. It will not in any way, shape, or form fully describe all of food as medicine, baby steps, right?
Mhm.
But it will give us the beginning of, starting to more fully describe what medically tailored meals, medically tailored groceries, and produce prescriptions look like in practice. So, and there are pieces of that work that the public can participate in. So
Sure.
look out on the FIMC listserv for that.
HHS website rolling out coding for food. I mean, two very fun items in the next 2 months here. That's awesome. Alissa Wassung, the FIMC Executive Director, thank you so much for joining me
Oh, this was
this
so fun.
morning. This has been a
Yeah, thank
great
you.
conversation. Props to your entire team there. Keep up the good work. Please check out the FIMC website. Is it just FIMC.org?
It is FIMcoalition.org. And on that note, just major shout out to my incredible teammates, Maya Park, our manager of membership and accreditation, and Kate Hensley, our manager of policy and projects. I would not be able to do this without them and without the amazing volunteers on our committees and as part of our community of practice, like you, Ethan. So
This is
thank
a
you.
great, seriously, this is a great team. Please go to their website, check out everything. The history is all there. All the work that Alyssa's done in policy is all there. But what a great conversation. Thank you for doing this with us. Anything else, Alyssa?
Oh, just have a happy and healthy rest of 2024. I know this is a big, big time for most of our service agencies across the country delivering holiday meals, making Thanksgiving special for clients. So
Yeah,
support them, volunteer with them. Those of you who are in them, I hope everything is fantastic. And just thank you again, Ethan. This was
of
a
course. Of course.
conversation.
Of course. Well, thank you. This concludes part 4 of our medically tailored, what is a medically tailored meal series. My conversation with Alissa Wassung, the executive director at FIMC. Please stay tuned for part 5. And thanks again, Alyssa. We'll sign off.
Absolutely. Take care, everybody.